Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by 90 Day Jumpstart, a program to help you increase production and break free from financial stress. On today's episode, we have Dr. Chad DePlantis, a seasoned restorative dentist based in Fort Worth, Texas. Dr. DePlantis began his dental career back in 1999 and has gathered extensive experience in the field, particularly in crown and bridge work. On today's episode, we are talking about a clinical mistake, and Chad shares with us a mistake that he has made and how he has learned the art of communication with patients, and how that art has helped him as he has progressed in his career. Let's tune in. Chad DePlantis, welcome to Dental Fuel. How are you doing today?
Doing great. Thank you so much for having me.
I'm so excited to have you on our podcast today and to chat with you and chat a little bit about what you're doing and a little bit about Dinks as well too. But before we get into it, I would love if you would tell me and our listeners a little bit about yourself.
So my name's Chad DuPlantis, and I am a restorative dentist. I practice in Fort Worth, Texas, in a small group practice. I have been doing this now for almost as long as David Rice, but really graduated from dental school in 1999, and I've been in this particular practice since 2003.
Very cool. And I see we're aging David a little bit. I love it.
Yeah,
love it.
we have to. We have to. He's not here. Right. He can't defend himself.
And I love that you're a fellow Texan. Are you a born and raised Texan or a transplant and ran into Texas as soon as you could?
What's the phrase? I got here as fast as I could. Yeah. I was born in New Orleans, and New Orleans is a great place to call home. I apologize to any of my friends that have lived there their entire life, but I moved to Texas when I was about 4 years old, and I'm a lot older than that. So I would say I've lived here most of my life.
Where did you grow up in Texas?
Split my childhood between Houston. I lived there until I was about 11, and then I graduated from high school in Plano, Texas.
Nice.
And then I would say the other place I got to as fast as I could is Fort Worth, because Fort Worth and Dallas are very, very different cities, although they're very close in proximity, very different cities.
Oh, absolutely. Yeah. And did you go to dental school in Texas?
I went to dental school in San Antonio, did my college in Austin at the University of Texas, thus the Longhorns behind me. And, and then I went to dental school in San Antonio.
Oh, very cool. Well,
and I'm assuming you're from Texas too?
Yeah, I'm a Texas native. I'm from El Paso, and I went to school in Houston. So born and raised out here. I'm back in El Paso now, and I work right outside of the city in New Mexico and help out a little bit at the new dental school.
Did you go to Coronado?
I didn't go to Coronado, no, but I know where that is. And I went to Eastwood, which is our slogan is El Paso's finest. So
El Paso's finest.
Just trying to represent El Paso.
I have a good buddy who actually does the photography for our practice, Javier Herrera, and he went to Eastwood.
Oh, very cool. Yeah, El Paso's finest. Well, tell me a little bit more about the practice setting that you're in. So you said small group practice. How many docs are there?
There's just two of us, two doctors. So we have three: front desk, an office manager, director of first impressions, and an insurance coordinator. And then we have three hygienists, three assistants, and three doctors. So 3, 3, 3, and 2.
Cool. And what's your favorite thing to do in dentistry?
Crown and bridge, restore implants. I'm very, I would say, in tune. I hate the word expert. I know that a lot of people like to say that, but I hate the word expert. So I feel to be very in tune with technology. And so, you'll see a lot of gadgets around our office. And we'll talk a little bit about that in a minute. But yeah, anything technological, I love. And that usually is crown and bridge and implants.
Cool. I love technology as well too. I work in public health, so not too much technology out here, but
not
still
too much.
No, not too much.
Yeah.
Well, Chad, here at Dental Fuel, we are dedicated to learning about people's mistakes and growing with each other from those mistakes. So I would love to lead into a little bit about a clinical mistake that you have made in your time of practice and how you learned from that mistake and have grown from it.
So I read the questions before, but
So
I
you're
think
ready then.
I was going to say that my practice has been somewhat, we all make mistakes, and there's a a size of mistake that you make that makes a difference. But the facts are is that we all learn from our mistakes, and sometimes it's hard to admit them. But I would say there's two that kind of set in my mind, and I would say that the first is on a micro level. Let's go back to one particular patient. Um, we were doing a bridge from 12 to 14, went to extract 13. 12 had a large alloy in it. And when we're elevating 13, 12 breaks. So now it's an 11 by 14 bridge. And, I think it was much younger in my career, but I'll never forget that. And the patient's still a patient to this day. But, the thing is that I saw it as a mistake because I didn't appropriately plan and really notify the patient that that was a possibility. And I think, we look back on things that we've done, and so the next time I had something like that come along, it's like, all right, look, we're going to take out 13. 12's not in great shape. It's a suitable abutment for a bridge, but with the size of the alloy in it, there's a chance that as we're extracting 13, it could be a little bit difficult. 12 could break as well. And we just need to think ahead what our contingency plan is. And, I'll never forget that day. It was just a long day, and I went home just totally dejected. And of course, after the extraction, she ends up getting a sinus infection. It's right over the Christmas holidays. So I felt like that whole Christmas was just riddled with calls and antibiotics. And, like I said, we got through it, and thank God, but we learned from it. But
if only emergencies didn't exist during the holidays, right?
I know, right? I know.
Yeah,
I'll never just walking out of church Christmas Eve, the phone's ringing. Hey,
oh man,
I'm still in a lot of pain. Crap. But on a macro level, I would say that my biggest clinical mistake that I made when I first started out was over talking. And, I think that we learn so much in dental school that we end up sometimes just spilling our guts and talking too much. And whereas we need to be a listener, we need to present the findings, we need to present the options, and then we just need to shut up. And if you can present it convincingly enough, and you're not selling, you're educating. And if you can present it convincingly enough, the patient will talk their way either into treatment, hopefully, or out of treatment. And then it's just our job to hopefully redirect as to what's in their best interest. And so, maybe a little piece of advice is don't talk as much as you listen, and just, be a very good listener to the patient. And that's, I always say this, you have to listen to the patient that's in the chair, not the patient's guest that's in the corner, the patient that's in the chair. You got to hear what their problem is, what their wants, what their desires are, and formulate needs for them.
Yeah, that's so interesting that you say that. I think that it's always interesting to see how kind of patients talk through what they're hearing and the options that they're presented with. And you're right, they will kind of come to a conclusion on their own. And it's so funny because when I'm at the school, sometimes, the students will be like, well, say they'll need a denture, and they're like, well, I don't want to leave them without teeth for so long. Like, I feel bad for them. I'm like, well, yes, that's part of, our profession, but the patient is on board for it. They 100% kind of know what they're going into, and they may not know until they're there. But if they've already accepted it, sometimes it's hard not to put our emotions on them or talk them maybe in a different direction than in a way that maybe they're already accepted to go towards.
Exactly. And, it comes down to financial decisions too. You've got to stand behind your fees, which represent the quality of care, your education, the quality of restorative procedure that you're going to give this patient or perform for this patient. You got to stand behind your fees, and that's the hardest thing to talk about. But I'll never forget, several years ago, I presented a case that was $60,000, and that's very hard to present. But you present it, and you stop, and then you just field questions. And, it's amazing the conversation that the patient will provoke after the fact. Once they swallow that initial pill, they just start, speaking, and, a lot of times you work it out. So don't be fearful or don't be embarrassed by your fees. Be proud of them, and, understand why you charge what you charge, and the costs that are involved with providing quality care.
What did you do to help you become more comfortable in, selling, I guess we can say selling that treatment and those costs to your patients?
Honestly, I think it was kind of just a self-realization. I think the biggest part is confidence. We don't have the confidence that we need when we get out of dental school. At least I should say most of us don't. And if we do, I don't know that we have the skills to back it when we get out of dental school. So it's a matter of taking the time to perfect your skills, working on your communication. Communication is just such key. But really it boils down to what we just talked about, is listening. You've got to be a better listener. And I think, in time it will come. I know that there's a bunch of courses out there. There's a bunch of coaches out there. But really mine was a self-taught, just realization, of becoming a better communicator, which started with listening.
Speaking of on courses and coaches, are there any courses or coaches that you felt really made an impact in the way that you practice?
Yeah, there was actually, going back to your previous question, there's several continuums out there. I know Dr. Rice took Pankey, other doctors took Dawson, some people have taken Coyce, some people have taken LVI, and some people are a little confused and they've taken all of them. And that's okay too, because hopefully they assign themselves to at least one thing from one. And, hopefully they've honed in on where their beliefs are. But I was fortunate. We had a doctor in this area, Dr. Stephen Cutbirth, and he ran a two-part continuum. It was a aesthetic restorative series and then a master restorative series. And I learned a lot from him about communication, about treatment plan and case presentation. And then, of course, I was able to hone in on my clinical skills. So I owe a lot of credit to Dr. Cutbirth. Prior to that, I did an AEGD at Baylor, which really helped me hone in on my clinical skills as well. But I think the biggest part of the way I practice came from Dr. Stephen Cutbirth, and I still have, I'm staring at them right now, all the manuals, which are in print because it was a long time ago, from his courses, and I refer to them occasionally. But I think there's several schools of thought out there, and I think the best way to figure out which suits you best is just to talk with colleagues and figure out, their why they did, the one that they did and how it's benefited their practice.
So was it at one of these courses that you learned to buy all these cool gadgets that you mentioned that you have in your office?
No, I think he would have completely disagreed with me on some of the gadgets that I bought, but that's just through working with manufacturers and kind of seeing what's coming out, and developing relationships through the years with both manufacturers and colleagues, and trying to stay ahead of the game.
Thanks for tuning into this episode of Dental Fuel. Join us next week as we talk about a financial mistake Chad has made and how he overcame it. Be sure to follow Chad Duplantis on Instagram, toothdoc_dupe. You can also find him every Wednesday night with Dentists in the Know. Be sure to follow them on their Facebook page and listen to their podcast on all major platforms. You can also follow them on Instagram at Dentists in the Know. Are you a dental associate? Do you feel overwhelmed by your debt? Wondering if this whole dental journey is worth it? There's a better way. Introducing the 90-day Jumpstart program. We'll show you how to grow 90K in 90 days. You work so hard to be here and you deserve it. Be sure to check it out on ignitedds.com.